I'm Jenny Brook. I am a physical therapist with Brooks Rehabilitation, and today I'm going to talk about dry needling. Dry needling is a skilled intervention that uses a small filiform style needle to penetrate the muscle in order to help release a trigger point or a tightened region of the muscle. It can also help to release underlying connective tissue dysfunction. Dry needling can be utilized to help assist patients with pain at any region in the body. When patients experience dry needling, the most common side effect that they will have is a cramping type sensation, such as when you have a good muscle workout. The most common side effect is bruising or bleeding, which happens very infrequently. It is important to note that dry needling and acupuncture are not the same thing. While we both utilize a needle to help stimulate underlying tissue, in dry needling, we are affecting change at the muscle in a region of top band and a trigger point, whereas acupunctures has a completely different theory and methodology that they use that dry needling therapists are not educated on. This is a new intervention that we are excited that we get to offer at Brooks Rehabilitation to our patients.